In the last week in the UK, we have seen 37,258 cases of coronavirus on average each day. The NHS is under intense pressure across all parts of the country, with 37,899 people in UK hospitals with COVID-19, and that includes 4,076 people on ventilators. Sadly, today, 592 more deaths were reported. Our health systems across the UK routinely work closely together, offering support when it's needed, and from vaccines to ambulance services, we are stronger together. And the UK is stronger together in the fight against this pandemic. And I know how tough that fight is. Thankfully, there are early signs that the actions that we're taking are working. The rise in the number of cases is slowing and falling in some parts of the country, like London and Scotland. At the same time, the number of vaccinations is going up. Like many of you, I've been talking to members of my family who've just had the call to be vaccinated. It's a really emotional moment when people get vaccinated. It means so much to people because this vaccine brings safety to that individual and it marks the route out for us all from this pandemic. And I'm very proud to be able to tell you that as of last night, we have vaccinated 78.7% of all over 80s. That's almost 4 in 5 of everyone aged over 80. And I'm delighted that you can see from these figures that there's so much enthusiasm for vaccination amongst the over 80s, because octogenarians know what scientists know, which is that the vaccine saves lives. Of course, the rate-limiting factor to this vaccination programme remains supply. As we know, supply is tight. We've had a very strong performance in this past week, and I'm confident that the NHS will be able to deliver every shot that's made available to it.
1 in 10 people having immunity is a far away from where we need to be. The herd immunity is a word that we use to describe the immunity that we get from vaccination. The big job here is to roll out the vaccination to those individuals, first of all to those who are at high risk of death and hospitalisation, and then to the rest of the population. Once we've done that, then we will have herd immunity. We should not be focusing on getting infection and the consequences of this infection getting us out of where we are right now.
The change to the international rules was because we don't want to see any of the new variants that have that risk from the vaccine arriving on our shores here, and we're dealing with the ones that we've found here. Susan.
Thank you. So there are 4 laboratories in the UK doing detailed vaccination and convalescent sera studies, and that's in Imperial, Oxford, and 2 PhD laboratories, Portendown and Colindale. The consensus view from those 4 laboratories have all done different experiments, is that the current vaccine works against the variant that was first discovered in the UK. That is very, very reassuring.